Okay.
కొంచెం కాదు సార్ కేజీ
Okay. Good afternoon. As we all been locked down because of this pandemic that we had and the second wave, and I would like to talk to you about the effects of being obese and the outcomes on these obese patients from this pandemic, COVID-19. Okay, let's give some summary of this, the second wave that we had today. So, unfortunately, we've been hit by this coronavirus last year, and we had the first wave in a phasic ways in different parts of the world, and in India we had the COVID-19 somewhere June, July time, and it has hit to the maximum extent somewhere in end of July and August. So in the Western world, the first phase finished by the time, and the second phase, the first phase in India started during that the later part of the months. So in UK we had a second wave again in December. For India we had the second wave hit in March. So let's see the differences between the first phase and second phase. Certainly the infectivity, that means the way it, when somebody is affected with coronavirus, the person sitting next to them or in the close vicinity, the infectivity is quite high in the second phase. Certainly the mortality on the second phase was low in Western world, but we had quite high mortality in India. We think this is because of the mutation that we had. And also I noticed that in the second phase in India, because for the first phase I was in UK, and when the second phase started in UK I was here in December, so that I'm just only comparing things. And also we have a lot of knowledge from the coronavirus over the last 12 months. And during this second phase, what I noticed was that a lot of younger people are being seriously unwell, and the mortality is being quite high, even in the late 20s and early 40s. Before, we used to think that only the older generations used to have the severe disease and they used to die, but with the second phase in India at the moment we have higher mortality in the relatively middle-aged group. And when we look at the case studies, this mortality tends to be higher in people who are obese, and this we have noticed already in the first phase as well. So I would like to talk about the obesity. What is obesity? The effects of obesity in patients having coronavirus and their hospitalization. So let's talk about obesity to start with. People who are fat are likely to get admitted to the hospital with the coronavirus are 3 times higher, and the one who are admitted to the hospital requiring higher oxygen exchanges and intensive care treatments are also much higher. So how do you define and what measures do we have? And then I looked at the WHO criteria of the overall presentation of these obese patients and their hospitalization, and also looked at the intensive care admissions, same as the CDC as well. So the people who are malnourished, that means the BMI less than 18.6, also at higher risk. And the people who are the class 1, class 2 obese, that means BMI over 30 to 45, are also higher risk. So what is BMI? It's called body mass index. So this is measured on your weight compared to your height. So everybody should know their body mass index. So, and then also, we all know that if you're fat, if you have more fat around your belly, you are higher risk of developing diabetes. So, looking at the cohort of the patient who are admitted to the intensive care, a lot of these patients who are fat, who are obese, compounded with the diabetes, we notice that patients who are diabetic are very high risk of having complications with the coronavirus. So we are using a lot more drugs in those sick patients, including the steroids, which obviously have an effect on the sugars, which compounds the complications. That's one of the factors. The main factor is the immune system itself is deranged in these obese patients, and they are diabetic. And the worst thing is that they compromise their ventilation aspects. So that they're normally short of breath if they're walking short distances, and if their lung is a little bit more damaged or even like partially damaged with coronavirus, their oxygen requirements are high, as you could expect. So if the CORAD score is a bit higher, that means if 50% of the lung is affected, guess what's going to happen to them? Or if your CORAD score is more than 15, so they are going to be even sicker. Not only that, if you're assisting their ventilation and you need a higher amount of oxygenation, and also the chance of intubation is quite high and the mortality is quite high. So the studies have shown that if you are fat and if you had coronavirus, you're 3 times likely to get admitted to the hospital and more likely to be in intensive care and more likely to die. And also the facts that showed that people who had coronavirus who are in intensive care, to ventilate their lungs better, we need to keep them prone, where we make them lie on the belly, because it helps to expand the lungs properly and then gets the oxygen levels much higher. So, the message I would like to address to the people who are diabetic, who are fat, should take extra precautions with this coronavirus. Not only just the coronavirus we need to talk about. We know from scientific evidence people who are fat has got more comorbidities, including sleep apnea. Sorry about this. Where they have a lot of snoring. They have higher heart problems, stroke, blood pressure, and diabetes, of course, and metabolic syndrome, fatty liver disease. So are we learning anything from this, from being fat or obese? So every disease tends to hit them badly. And currently I'm talking about this COVID is because this is what's really bothering all of us. And I see lot patients calling up saying how short of breath they have been, how unwell they have been. And their prognosis tend to be bad in those obese patients. So let's talk about how we can look at future. So I just talked about what are the effects of being fat, what's the effects of having an infection, and is there anything that we can do? Okay, first of all, protect yourself, be safe, keep away from crowd, wear the mask, clean your hands, stay at home, and work from home if it is possible, except the key workers. But I notice we have a limited time in the morning to have free roaming. And I noticed this morning when I'm coming back to work, the roads has been absolutely blocked, and we have 3 times more crowd in the shorter period of time because of those measures. So I think the people are getting the bad message by having the lockdown restrictions to those hours. This purely, there are lots more shops that are open who are non-essential shops. What we consider is that we don't need to have them day-to-day living. So that's a big difference I have noticed from London or England to here. So they basically made it hospitality services, which is not required to be open. Pubs are not required to be open. Clothing shops not required, it's not essential. We all had some clothes to live for this lockdown period, I guess. And the essentials are the ones we need for that day. For example, if you have needed pure water to drink, you need food to buy, for example, vegetables and fruits, and those things are considered to be the essential ones. But I noticed there are a lot more things that happens in those restricted hours of permitted hours on the mornings where they're being overcrowded. You go to any place and there no social distancing, and I strongly recommend that be sensible, try to be yourself, to say, well, I'm sure a lot of your loved ones been affected with this. A lot more are still spending time in the hospital. Please spread these words to say, is it really required to be outside? How essential is this? If it is not essential, keep away from those things. And be responsible. Number 2, what can you do at home while you're doing all these things? Because the kids are at home, families at home, and try and be active and make yourself an hour or 2 an activity time where you have a family physical activity in a way that you do some exercises together as family and try and lose weight. Keep targets. Keep healthy diet. And try and monitor your diabetes and keep the sugars under control. The best advice I would recommend is keep the carbohydrates down. Have more protein. Lots of water. Number 3, a lot of people says, I have tried all these things, nothing worked. And this category of patients who's got resistant way of losing weight, and they do need some help. I'm more than happy to help you out, and you can do a video consultation if required with me at Kim's Hospital. You can reach out, you can type my name in the Google and you can reach out to me. I'm more than happy to speak to you. And some people do need assistance, extra assistance to lose weight, because we're not just talking about the second wave, we're not just talking about the COVID, we're just talking about your health, your well-being, your long-term life. Don't just think that, oh, I'm just a little bit fat and it's just a cosmetic appearance. It's not that. It's overall health. I noticed within our family, people who are obese has been badly affected. And that's the reason I take a social responsibility to bring it to your attention, to pay attention to your body, to be healthy, and I'm more than happy to help you out through. Please reach out at Kim's or whatever website you can see me on, and I'm more than happy to talk you through. Thank you very much.